My name is Mohammed Abouelsoud. I give a lot of presentations to local schools, so they know me as Mohawk Mo. Mohawk Mo. And we develop brain stimulation devices for Parkinson's and Alzheimer's disease. Show of hands, who here knows Neuralink? So we are the non-invasive Neuralink. We developed a device that can record information from the brain and deliver targeted electric fields in certain regions with no surgery. And as you know, current treatments for these neurological disorders fall in 1, 2, 3 buckets. You got surgical, you got pharmacological, and you got to use these big expensive equipment, these focused ultrasound equipment that are expensive. So we need a solution. We need a non-invasive, we need a safe. So what do? We have this. This is what we developed. We invented this. It's called amplitude modulated transcranial pulse random noise stimulation. It's a big fancy word for sending electric fields into the brain with specific pathways inside the brain non-invasively. We have this patented, and we invented this ourselves.
Mo, can you turn your mic on first?
Is it on now? Did you guys hear me?
Yeah.
Because I'm yelling. All right. So we have this patient here, tardive dyskinesia. This is what happens in Parkinson's disease when you take so much medication. Medication stops working. Look at his neck. This is a very dangerous situation for his neck. 3 days of stimulation, 15 minutes a day, down the cortical spinal tract inside the brain. We saw a massive reduction in tremor, very controlled movement, very rigid and very intentional movement too. We have over 250 patients. We've completed 4 pilot studies of many different diseases. We got Parkinson's disease. We just finished a N=30 clinical study in the Middle East. We developed a computer vision algorithm to analyze the movements of the patients and saw an 80% reduction in tremors. We completed an fMRI study for Alzheimer's disease, published in a book chapter, 300% increase in connectivity inside the brain after 12 weeks of stimulation, and many successful interventions in psychiatric disorders, depression, bipolar disease, with the published data. So we're very excited about the versatility of our tech. And as you can tell, intuitively, big market, right? We got a big market. We got many different diseases. We got Alzheimer's, we got Parkinson's, we got psychiatric. But the most important thing I want you to think about is our recurring revenue. One of the aspects of our stimulation is that the waveform, the electric field, changes. So it records information from your brain and it says, I need to develop a specific pulse for you. And so we change the field for you in your brain. And so we have a revenue SaaS model equivalent to a SaaS company where the pulses change over time for the patient. This device costs $250. Okay? A majority of the power of the device comes from the software, the machine learning algorithms. We have actually 3 granted patents. We got a new patent last week. And we're going to be working with distributors at scale to be able to commercialize our tech. We want to be able to partner with the big dogs. We want to be able to get this product out there. We want to help you. Now, as you guys know and tell already, very cost effective. Actually, one of the hallmarks of devices are cost effectiveness. And the fact that we have patients can pay out of pocket for this, as well as it's non-invasive, it's portable. In fact, our new unit, you can put it in your pocket. I wish I could do that, right? Look! But I know I can't do that. It's because it's being manufactured right now. It's being manufactured. So we don't have it yet, but we will have it. Now we have a high quality. I have a background in applied physics and computational neuroscience from Ohio State University. We have individuals from MIT, Johns Hopkins. These are directors inside the company who have been guiding clinical trial operations for the past 8 years. We have a Harvard-bound physician. We have an entire international regulatory expert because we want to get through all of the regulatory channels, not just through the FDA, as well as our legal counsel. So we're super excited. We're super duper excited. We have a lot of very powerful technology, and we want to be able to translate it effectively. We're doing a 500K rolling around into a 5M. The 500K is to complete our current clinical trials that we have already ongoing internationally. Is to finalize the manufacturing of this device and make it look a little bit prettier, all these little wires, And then we want to be able to finalize more patents. We have 20 patents just sitting in a Google Drive. We can't submit them. They're very expensive to submit. And then we already met with the FDA 3 times already. We have letter of intents of 8 clinical sites here in the United States to be able to run our N equals 200 pivotal trials for FDA de novo pathway. So we're super excited, guys, and we have a lot of great work to do, and we're very focused. So do you have any more questions?
Questions, hand raised.
The adjustments that are going to occur are you can talk about the recurring revenue model. Is that going to occur right locally on the device, or are you going to be connected to a
Bluetooth app. Yeah, very good question. It's going to be through a Bluetooth app that we have. And we also have it on the computer too, but it's like a single button click. Just click update.
Is that processing done on a smartphone, or where's the processing done?
No, we have an AWS set up, and we're going to be running our big machine learning models on all of that data. So all of the brain data that we get from all of humans, we analyze it collectively to be able to derive pulses for each brain.
Thank you.
Yeah, so I've had not personally, but some experience with ECT in family members and EMS. And each of those devices is very expensive and uses precise targeting and fitting of the helmet or the electrodes before they do any of this. And you're telling me even people with different hairstyles can put this on.
Yeah.
Can put this on, and it's $250. How are you rigorously aiming the waves to hit the right track?
So the cost to build is $250. But we're obviously going to have to sell it for a little bit more, but it's still in a reasonable price range. We use something called DTI, diffusion tensor imaging, which is a specific analysis, an MRI, where you look at fiber tracts inside the brain.
So this is going to be combined with an MRI?
It's not combined with an MRI. The MRI is just part of the pre-screening. Yeah, it's used at home.
You still have to position to those tracks though.
Yeah, so the electric fields, so we're going to have sensors on the electrodes that are going to be adapted to each person's brain to be able to see where it is on the person's skull. And there's a lot of electric field modeling that we have in our company. We have an R&D department where we develop something called a digital twin model of the brain, which is like an artificial brain. And we can be able to take the patient's brain and then send the electric field in accordance with their specific brain pathway and position the electrodes based upon their skull morphology.
How long does it take you to position?
A fitting is not going to take too long. The fitting procedure does not take too long because it's adapted. The electrodes itself has something called HOGO pins, and this is actually what we have patented. So it's a high density electrode array. Okay, in every individual pin can be turned on or off. So if you position the electrode half a centimeter to the left one day, the electrode will be able to determine that based upon how it's modified with the head shape, and then shift which electrodes are on in the sub-electrode array.
Thank you.
I have a similar question. Actually, I have a similar question. I'm working on the visual reality for the rehabilitation of the patient with cancer, brain cancer. And the same thing, they are very actually expensive, $30,000. Can you use that for patient with cancer care basically? And why the difference is so different? Like the 30,000 versus 300, just yeah.
Yeah, so the neuro-oncology field is something we are interested in, but it's not like neurological, like neurodegenerative disorders, because you have to tailor a specific electric field that leads to the stunting of the cell growth. We have electric fields that are exciting the brain. So you have to modify the actual field so you can send the cells a different signal.
We use this for the
So there are many studies that show that use specific types of electric fields to induce cell death in brain tumors. We are not moving there initially. However, that is in our clinical roadmap to be able to start running those pilot studies.
Thank you. One more round of applause for Mohammed.